Good afternoon. Are you guys awake? Good afternoon.
Good afternoon.
I know many of you are friends out there, so I'm really glad to be here today. I'm Francey Youngberg, as Gloria mentioned, and it's really a pleasure to be back here. It kind of ages me since I remember doing these conferences back in 1996 when at the time, this institute was called CAPACI, the Congressional Asian Pacific American Caucus Institute, and I had the privilege of working for then outgoing Congressman Norman Mineta and also with Admiral Ming Chang. So that was a really wonderful time, and I wanted to just give you a short description of our fellow panelists, and each of them are going to talk a little bit about some of their federal agency plans. And today, unfortunately, Rebecca Coakley couldn't join us. She was not feeling well, but we're very fortunate to get Bryan Jung, who's sitting there towards the end. So he's substituting for her. And we want to leave a lot of time for questions, but we also want to end promptly at 1:40. So if we could please observe that, that would be great. So just wanted to start off by saying that it's really been a wonderful way for APAICS to be able to put this together, because I know how much effort has gone into even just having the White House initiative on Asian Americans and Pacific Islanders be up and running. And I think many of you who work so tirelessly in the communities that you serve to make sure that Asian Americans have adequate access, whether it's language, whether it's outreach, that this is really a time for you to learn what's being done and how can you plug into that. So we're really fortunate today to have David Kim here, who is from the Department of Transportation. He's a Deputy Assistant Secretary for Government Affairs and a good friend for 20-some years. And so it's really a great privilege to be doing a lot of these sessions with him. I think we're going to be doing this more in the future. And then next to him is the Honorable Tammy Duckworth, who is the Assistant Secretary for Public and Intergovernmental Affairs from the Department of Veterans Affairs. And I think many of you in the room have known Tammy, and when she ran for Congress, and we're very proud of her and quite an inspiration to all of us. You can find their bios again are in your program, so please, I'm not going to take too much time here to describe all her accomplishments, but needless to say, they're pretty lengthy. And then next to her is, as I mentioned before, Bryan Jung, who's here with us, and he is the Director of Special Projects at the White House Office of Public Engagement. And so since I work in public engagement, I get to have emails from Bryan very often, and we work on a lot of the same things that I think a lot of you really care deeply about. So I'm going to have Bryan just introduce briefly the person to your right.
Actually, also with us today is Paul Monteiro, who is a colleague of mine at the Office of Public Engagement. And we'll also be, as Rebecca is not here, they're kind of big shoes to fill. So both of us will try to kind of answer any questions you guys may have on that scope. But Paul Monteiro. So
that's great. Thank you. Well, I guess it takes two of you to replace Rebecca, huh?
Presidential personnel.
So first, I just want to tell you, I think it's probably better for me to talk about the HUD agency plan under the White House initiative, which I'm really happy that it's at the very highest level. Deputy Secretary Sims, many of you know Ron Sims, and he is married to Kayan Topacio, who is the sister of Gloria Kawili, which I don't think a single person in this room doesn't know. So needless to say, Ron has always been a champion for Asian Americans, even when he was King County Executive. So now that he is over at HUD, he's really taken a leadership role. He represents HUD at the White House initiative. And we've been working very closely with Kiran Ahuja and with Daphne Kwok on figuring out what are the most critical things that we could bring to the table for Asian Americans and Pacific Islanders. I find it strange that for so many years I was on the outside asking for language access, asking for, making sure it gets to the ethnic media, making sure that we're always included at the table. So I guess it's fair enough now that I'm on the other side to see how that can be implemented and what it takes to make that happen in an agency that it has we have 7,000 some employees and we have $46 billion budget. So how do you get these priorities to be important to the people in that department? So for HUD, we're focusing really on a few key areas. One of them, I think some of you are aware, is that we are working very closely with Incapacity, Lisa Hasegawa's group, the National Coalition of Asian Pacific American Community Development. They were the first recipient of the housing counseling grants back in the fall of 2010, and they got about $895,000 because we wanted to make sure that there would be in-language assistance for people who are facing foreclosure, and that's been such a huge problem for the country, as many of you know. And so it was really key that Lisa and her group were able to then subgrant some of those funding to a lot of other agencies that can reach our population. So that's one of the things that we did this past year. The other is, as you very well know, it's competing for federal funds. So we had worked very closely, and this was an initiative by Deputy Secretary Sims, is to make sure that the grant called the Sustainable Communities Grant that we had opened back last year, we awarded about 80 grants, about 170 million, and that's including the funds that we did with the Department of Transportation. And so in putting out that notice of funding availability, one of the sections that I think was important for our community is make it a requirement that the people who are applying make sure that underserved communities are brought to the table and that they're able to be included, their viewpoints are included, and you will get points as you are graded once those applications are sent in. So I think for the first time, thanks to this effort, they were able to bring people of color, people from underserved communities, to be part of this larger consortium. Because as many of you know out there are many people who are very good at writing grants, and our community has sometimes not as much capacity to do that. So making sure that they have a seat at the table is really critical. So those are the two things that we have done. The third that's really important, which has been being spearheaded by John Trasvilla at our Fair Housing and Equal Opportunity Department. I think many of you also know John. He was able to put together and make sure that at least 100 of the most vital documents at HUD are now available in 18 languages, 18 Asian languages, I should say. And so this is very remarkable, and we're also working really hard under the Open Government Plan to be able to have a contract with a language line so that hopefully in the near future we would have the ability to have access in 120 languages. So those are three things that we've been working on. And I know that many of you have looked at the plan on the White House website, so we continue to really want to engage you for any recommendations and any feedback that you have. We were really happy to do that. So I was really very glad to have been at the Hmong National Conference 2 weeks ago, and this is one of the things that they were happy to hear. It's the first place I went to because I knew how underserved the Hmong community. And so that was a really great conversation, and I know David would probably talk a little bit more about their experience there with the Department of Transportation. So with that, I'm happy to take questions later after all the panelists have had a chance to talk a little bit about their agency plan. And of course, I think you all know where to find me, so I'm happy to do that too. So I'm going to turn it over to David first and have him talk about the Department of Transportation plan.
Thanks, Francey. Good afternoon. I know it's after lunch, so everyone's still starting to get groggy, so we'll try to move through this quickly. When you think about issues that have historically been of importance and of concern to the AAPI community, transportation oftentimes does not come to mind right away. It's issues like civil rights, immigration, education, and healthcare. But if you think about it, transportation really plays a critical role in reshaping and revitalizing communities. And transportation systems are important, not just because they improve mobility and improve our commutes home, or maybe don't improve them, but they also connect people and places to one another, and they play a huge role in producing livable and sustainable communities. And so that's why transportation is directly relevant to the AAPI community. And all you have to do is look around the country, look at places where AAPIs reside, and look at the connection between our community and transportation systems. If you look at a place like LA, Little Tokyo is very well served by a transit system. Same with East LA, which used to be historically Japanese American community, but now is Latino. Those communities have been revitalized and reshaped as a result of the transit system in LA. And that's just one example. You can look at other examples all around the country for the connection between transportation and the AAPI community. And so that's why it's important. I just want to highlight briefly a couple of examples of where DOT has tried to play a role in the community. Last summer, for the very first time ever, DOT convened a community roundtable for the AAPI community. And this was done thanks to the good help of National Capacity, Lisa Hasagawa. I think Francey mentioned her as well. And so we had a group of 30 or 40 AAPI community representatives from all around the country come to Washington and meet with the top leadership of DOT. And it was just an incredibly enlightening, fascinating, and at times sobering dialogue between the community and DOT leadership. And if anything came out of that meeting, it's that clearly AAPI communities want to be heard. They want to have real, meaningful engagement with government agencies at all levels, federal, state, and local. And they want to be at the table. And that message was clearly heard. And we've done some good things as a result of that. And I think people really appreciated the chance to talk to DOT about some of these issues. So that was one thing, and that led to other things that I'll talk about a little bit later. A few months ago, NHTSA, the National Highway Traffic Safety Administration, which is an agency of DOT, and it focuses on highway safety, vehicle safety, and pedestrian safety. The leadership of NHTSA was in San Francisco a few months ago and met with a group of leaders from Chinatown and addressed pedestrian safety issues as it relates to especially elderly populations moving through Chinatown. I was not at the meeting, but it turned out to be a very meaningful dialogue and discussion with some solutions, potential solutions for improving pedestrian safety in Chinatown. And just last week, Francey started mentioning this, in St. Paul. Anybody here from St. Paul or Minneapolis? No? Okay. Just to give you a little bit of background, DOT is embarking on a brand new light rail project in St. Paul. It's the largest transportation investment in the history of Minnesota. But this project is not without its controversy. It goes through a historically African-American community, as well as a growing Hmong and Laotian community. And it's clearly going to have impacts, especially during construction. And for many years, even before the beginning of this administration, the local Hmong and Laotian community, especially business owners, have made clear that they have some concerns with the project and they want to make sure that there are mitigation measures in place once the project begins construction. So last week, the administrator of the Federal Transit Administration, Peter Rogoff, met with a group of local small business owners in the area and heard them out. And Peter made the point that this is not the beginning, or this is not the end of our dialogue, this is just the beginning, and we want to be back and we want to hear your concerns and we want to make sure that the mitigation measures that are in place for this transit project are meaningful and really work to the benefit of small businesses in St. Paul. And so we're hoping to be able to go back to St. Paul and Minneapolis over and over and over again and make sure that we are constantly engaging with them, having dialogue, making sure they're heard, and making sure that the project ultimately works for their benefit as well as for the benefit of the entire community. So those are just a couple of examples of where we've tried to have some meaningful engagement with the AAPI community. Francey mentioned earlier that through the White House initiative on AAPIs, every agency is supposed to submit an agency action plan. We have done that along with all of our sister agencies here. And I just want to highlight one of the goals. I won't go through all of them, but one of the goals of DOT's plan is to promote messages to the AAPI community about DOT's safety campaigns. Secretary LaHood is a man on a mission, and he talks all the time about distracted driving. It is an epidemic throughout the US, and probably 99% of us in this room are guilty of it. We all have Blackberries, we all have cell phones, we've probably talked on the phone and driven or texted on the phone while driving. We shouldn't be doing those things, but we're all guilty of it. And it's important for DOT to be able to convey those messages, those PR messages, not just to the population at large, but to the AAPI community in a linguistically appropriate manner. And so it will be our goal to develop a strategic communications plan to do just that, to make sure that these messages get out to the AAPI community where they are heard and where people can receive those messages. So that's just one example. And in the interest of time, I think I'll wrap it up there and turn it over to Tammy.
Great, thank you, David. Thank you, David. Well, it's great to be here. Had a great day yesterday for those of you who were out and about at all the AAPI events. And looking forward to a really busy month. I actually joke, both Secretary Shinseki and I are disabled vets. And so we have Disability Awareness Month followed by AAPI Month. And so at the end of May, I sort of look at him every year and say, God, when is Nordic American Athlete Month? Because then we don't have to do anything. But we can just relax on that month. But it's really great to be here. It's really an honor to join you all. I'm really proud to be part of the Asian American and Pacific Islander community. I am biracial. It's very funny because my background is one that allows me to say some tough things to folks. Because on the one hand, on my father's side, his family's been here since the Revolution. I'm actually a daughter of the American Revolution. And on my mother's side, I'm the child of a brand new immigrant to this country. I myself did not speak English until I was 8. Although my accent, I'm told, is a little bit of Hawaii still. So it all creeps together. Being in Washington is really a culmination of where our nation has grown over its lifetime and where we've gone with our past presidents. I think of President Obama as the first Asian president in much of the same way that President Clinton was the first African American president. President Obama, not only having an Asian family himself, has appointed the most Asians to cabinet secretary positions, to positions throughout government. And this is really changing the way federal government is addressing many of the needs of our community, because when you have someone from our community at the table, we naturally think of our backgrounds and the needs of the folks from our communities. In VA, we've done several things that are really interesting. First off, the number of Asian American and Pacific Islander veterans in the veteran community is only expected to grow. It's currently approximately just under 330,000, and we expect that number to continue to grow in the next several years for several reasons. One, there's greater diversity of members of the military. Two, it's also a path to citizenship for a lot of folks. So you do see more and more folks, just like in the Latino community, joining the military because that is a way that they can become citizens a lot faster. With that means that VA has to adjust, and we have to do better to serve all of our communities and all of the illnesses that those particular communities have and all of those concerns. Some of the concerns that we are already serving are education concerns. We have over 400,000 veterans in school in the GI Bill right now. Just as the GI Bill helped to grow an entire generation of game changers after World War II, the GI Bill, post 9/11 GI Bill, is now sending all these great veterans, many of whom are Asian Americans, to school based on the benefits that they've earned. And that is the way that we as a nation are going to out-educate the rest of the world. We're going to out-educate these amazing vets, and they're going to go on to out-innovate the rest of the world as they enter into our communities. At VA, we're also working to promote support for veteran-owned businesses. Asian Americans are some of the most prolific group of small business owners. And what we know in VA is that when you have a veteran-owned business, they tend to hire other veterans. So just by helping one veteran develop and start his or her own business, we know that we're actually guaranteeing employment for other veterans. And in doing that, we're also going to help our country to outbuild other countries and to outcompete. So helping the Asian community, helping the veteran community is only going to help our nation in the long run. Another thing that we're working on extensively in VA that I'm really proud of is our new media program. And I can safely say, truthfully, that I have seen Secretary Shinseki use the word Twitter in a conversation. He doesn't text, But he did say, that Twitter thing, Tammy, how are you doing with that Twitter thing to get out to folks? And our deputy secretary this morning in a conversation actually said, OMG. And I wrote it down. I said, on this day, 2 years into my job, I have managed to convert. But new media, social media is really the way that we're going to reach out to all communities and where veterans live and play. And it's definitely where we're going to be able to reach out to the Asian American community and the Pacific Islander community. It's especially critical for Pacific Islanders because they are remotely located. They have a hard time accessing services and care. And that means that we have to do a better job of getting information and services to them. And so getting out with telemedicine, getting out with counseling online, getting out, we have a homelessness hotline and a homelessness chat room that you can call 24/7. We also have a mental health counseling hotline and a chat room that's available 24/7, so we can actually get the care to people wherever they are. And this is really critical for these communities. When you go to mental health, you also are looking at the stigma that's associated with it. And it's a stigma that is especially critical in the Asian American community, where we tend to want to keep these things. There are things that are the shame of the family, and you keep it in the family, and you don't share this you deal with it internally whatever way you can. But if you can have a way for those families, through the privacy of their own home, to either pick up a phone or through a computer chat room, get the counseling that those families members need in their own homes, you're going to be better able to serve them. And as to date, we have about 11,000 saves from our suicide hotline and chat room. Those are actual suicides in progress that we were able to interrupt. 11,000 in the past 2.5 years, which is really quite remarkable. So what we do at VA is we're trying to increase access. We're trying to reduce the backlog, make it easier for people to access their benefits. We're trying to eliminate homelessness, and we're also targeting Asian American communities. Looking at those illnesses this is VA Research Week right now. Illnesses such as liver cancer, things that are common to Asian communities are also things that we're looking at in VA. One of the issues that I'm personally very involved in is the issue of diabetes and obesity-related illnesses. In the Native American and Pacific Islander community, if VA could reduce the number of veterans who are overweight, who have a chance of developing diabetes, if we could reduce that number by just 1%, we would save the country $12 million. Because while it only takes a couple of $1,000s to care for the health needs of a veteran, it costs $20,000 to care for the health need of a veteran with diabetes. And so we have to do a better job of reaching out to those communities in all the locations across this country where our Asian Americans and Pacific Islander veterans live. Thrilled to be here. I am proud to serve with Secretary Shinseki, who is part of that generation of veterans who in Vietnam certainly served this country at a time when we did not respect our veterans. Thrilled to be part of a tradition that goes back to the 442nd and the 100th Regiment combat team and what they did in terms of serving this nation, even as we did not respect their families and their rights. I'm proud to say that in modern day United States and in modern day military, our Asian American veterans get their full benefits, and if anything, we are extending greater outreach efforts to reach them. I remember serving in uniform and being someplace, I was in Egypt actually, and we all climbed out of our helicopter, and our crew was incredibly diverse. We had an African American crew chief, a Latino door gunner, a Southern white pilot, and myself, and I was the highest ranking person. And I remember the Egyptians coming up and wanting to look at the helicopter, and of course they went to the pilot and said, who's in charge? And he pointed to the door gunner, who was African American, and said, well, it's his airplane, you need his permission. And then he pointed to me and said, well, actually, she's the highest ranking. And like, that little Chinese girl is the one that's highest ranking? And I looked at him and said, look, yeah, but I'm not in charge. The dude with the bullets is the door gunner, and he's the guy that's in charge. But that's the strength of this country. There are many different voices. All of us who grew up translating for our moms and dads who didn't speak English. My mother, by the way, to this day, if she doesn't want to talk to someone, she'll still say, oh, no speak English. Baby speak English. I'm 43 years old. And she still says baby speaks English, and she's fine, but that's her way of getting out of things. But for those of us who come from that background, those of us who, as Secretary Locke was talking about last night, had to hide the fact that, even our diets and our cuisines and what we prefer to eat, and it's just to prove our Americanness. I think that's, there's still work to do, but a lot of that is behind us. And part of it is, what the president is doing is appointing more people into public office, more people into places where we can get folks to be game changers, people who can sit at the table and say, look, we need to translate these mental health hotline information into these languages. We need to increase outreach to places. By the way, the places where veteran populations are growing the most are New York, Virginia, Texas, California, all happen to be places where Asian American communities are growing. And so we have to do better by all of our communities. So when we do right by Asians, we're doing right by our country as a whole. And it's a real great privilege to be here. Thank you.
So Paul and I both work at the Office of Public Engagement, and but I know Rebecca Coakley was supposed to be here originally to talk about presidential personnel, which I think is actually a pretty important shot, because obviously all of us are here because of the Presidential Personnel Office. And obviously, as the Assistant Secretary has said, is that the number of Asian American Pacific Islander appointees are at an all-time high with this administration, and I think it goes from the most senior levels, where cabinet secretaries, to even the most junior levels. So this administration, as the President has committed to, wanted to make sure it was as diverse as this country. And so that's why we have such a wide-ranging group of folks that are in the administration, and not people just doing Asian American Pacific Islander outreach, but also people that have valuable experiences, like my colleagues here on the stage, that have a real policy impact in the discussions, and are far more are kind of experts in their field, and not just an AAPI person in the room. And so I think it speaks to the breadth and depth of our appointees. And just to kind of go over a brief overlook of the presidential personnel process, I think that Rebecca, if she was here, would tell you that it's an open and clear process, even though I think a lot of people in this room would disagree. But obviously, if there are kind of folks that are still interested in working in this administration, we should definitely be sending resumes forward, because obviously there are always different needs that this administration has. So I encourage you to do that. And I know that there are a variety of channels in which you can do that, but also feel free to email me directly or Paul when it comes to that. And I think the important thing to note about this kind of vast kind of diversity of people we have is that it also speaks to a pipeline of leadership. And so for me, it's like I have people that I can definitely look up to and stand on their kind of shoulders and kind of look back and think there are people that have worked really hard in their own lives to kind of pave the way to make my life, obviously better and easier to kind of work in this administration. Like David said, a generation ago, we may not be as diverse in the room, but we are now. And so I think I at least am very much indebted to the leaders that are kind of before me. And it goes a long way, especially when there are people like Chris Liu and Pete Rouse that are at the White House, and people that are senior folks that I can always look up to and ask questions, and it actually makes the biggest difference. And so I think having that pipeline of leadership is a critical piece as well. But before I kind of go into more of the Asian American Pacific Islander kind of outreach pieces we're doing at the White House, I'm going to turn over to Paul, who I know I work very closely with at the office with just a number of issues we tackle every day. So.
Great. Well, thanks, Brian. I just want to say it's an honor to be on the podium with all of the co-presenters, and definitely you, Madam Secretary, for all you've done for this country, so thank you. And I don't have a name tag, so I'll say my name a few times, Paul Monteiro. But instead of a name tag, I brought my family. So my mom, my grandma, and my aunts are right there on that third row. All the way from Palau, by way of Maryland. Palau's finest there. I lead our religious outreach as well as outreach to the social safety net community. I've worked for the president since 2006, started in his Senate office, then to the campaign, and then to the White House afterwards. Because the president recognized, from way back in the 80s when he was organizing on the south side of Chicago, unless you work with the religious community, anytime you're trying to deal with sort of systemic societal problems, you're not going to be able to make as much of an impact. So Working with many religious communities, for 5 years now, I know that the religious identity in the AAPI community is a strong one, and as it's said of every constituency, no one's a monolith. And you think of the range of religious traditions represented in the Asian American Pacific Islander community, it's everyone from Catholics and Christians to Muslims, Buddhists, Sikhs, Hindus, and non-theists. But we've been making a sustained effort over the last few years to engage all of them. I think last year, SALDEF had their gala in this very room, the Sikh American Legal Defense and Education Fund. And many times the conversation, when they're coming, using their religious identity, it does center on the civil liberties concerns and issues. Obviously with the Sikh community, the issues of profiling at the airports. Their wearing of a ceremonial blade on the plane gives TSA heartburn sometimes. Obviously, profiling and sort of other sorts of discrimination that's perceived or real around the country with the Muslim community. And the Sikh community always, many times, gets conflated with the Muslim community. Working with Buddhists and Hindus and even the Jain community, really making a sustained effort to reach out to religious communities that aren't normally players at a federal level, that are sort of living their lives, doing the work that they do, trying to bring them together to use the convening power of the White House to apply the strength that they bring to deal with the challenges that we're facing, whether it's sustaining the economy and helping catch those people who are falling through the cracks that would otherwise fall pretty far away if it wasn't for that social safety net. Working on immigration issues, everyone from who's concerned about relatives who are trying to get to the United States, or those who are worried about their jobs, or trying to get skilled laborers over here to do the work that we need to win the future, as the president often says. Working on issues like healthcare, as it has been said before, many different issues that are related to healthy living and healthy lifestyles and active lifestyles. And the First Lady herself has launched a Let's Move initiative for faith communities, because many times if you're trying to deal with how people see the world and how they see their bodies and how they treat their bodies in terms of what they put into it, you're not going to get very far if you leave the religious community out of that, because many times our eating habits are formed at a very young age because of our religious traditions. So on a number of issues, it's actually hard to think of an issue that isn't touched by many people's oh, there we go. All right, Mom, you don't need to tell people my name anymore. But it's hard to think of an issue that doesn't touch on people's religion many times. So that's really the sort of bottom line as to why I have a job, because the president understands in a way that sometimes people don't. When you're talking about changing people's attitudes, their mindsets, how they see the world, how they see one another, you have to have the conversation with the faith-based community. So I'm happy to do that work and maybe take some questions afterwards, but I want to turn it back over to Bryan because I know he had some more to present on. Thank you.
So, on top of kind of all of the kind of issues that our folks out of the agencies are constantly working with that intersect with the API community, a lot of the things that we try to push out at the White House is actually in conjunction with the White House Initiative on Asian Americans and Pacific Islanders. And I know some of the folks are in this room are here as well, staff. And so working with the initiative, what we try to do is I think is twofold. One, to make sure that there's an interagency working group that I know the secretaries are part of, and making sure that the issues that that their agencies face are consider AAPI populations, and as well as making sure that issues of concern to the AAPI community are heard throughout the administration. Also, at the same time, we have a great group of commissioners that work alongside the initiative, some of which are here today, and those folks bring a wide variety of expertise and experience to the commission and the initiative to kind of help advise on things, whether they may be regional, industry specific, and they do all on their volunteer time. And so, actually, I have to give thanks to them as well for doing what they do. But I think a lot of it is just trying to get our message out from just being in the Beltway. Oftentimes we're stuck in the echo chamber of DC, in which we kind of talk to each other and understand the issues and policies that we're all working on. But at the same time, what good is it if we don't kind of let the community know that we're actually doing things? And I think a lot of it, like Paul had mentioned, it's winning the future, out educating, out building, out innovating. And it's something that I think we have to make sure that folks in our community know about. And I think that there are a lot of policies that we are all working on to improve the lives of AAPIs, and I think we just kind of need to make sure that that kind of gets into where we all, as a Los Angeles native, need to make sure that people in LA know about it, and wherever you guys may be in the country. I think it's important for you to kind of understand what the administration is doing, and if you don't know, we will make sure you know. So I know that in the upcoming days, we'll be putting something up on our landing page at the whitehouse.gov/AAPI, and I think we'll give you a kind of a breadth of what we're doing. And I think that actually, just to plug, tomorrow we'll be having a community leaders briefing at the Department of Interior, just because it's the only space that's big enough to hold kind of the crowd that's coming. And kind of get to hear straight from senior administration officials what we're doing to improve the lives of the API community. And so if you haven't signed up for that yet, feel free to find me afterwards, and we'll make sure you get connected. And so with that, I think we're going to open up some.
I just wanted to add and commend the White House Office of Public Engagement in really engaging the principals across the different agencies. I know that at HUD we have 19 principals that are traveling to reach out to different constituencies that they have identified for us as priorities. And just want to tell you a really quick story about why it makes a difference to have Asian Americans at these different levels. Is because when I went to St. Paul a couple of weeks ago, there were several members of the Hmong community that we wanted to reach out to, and there were 18 clans, and I didn't realize that they drove 4 to 6 hours, some of them from Milwaukee, some of them from all over the area, just to come and say to me that I was the first person from the Obama administration who has come and really wanted to listen to their concerns. And it was and I brought with me our regional administrator from HUD, who was responsible for about 5 different states, the field office director from St. Paul, and several of the other program offices where I knew some of their issues can be addressed. And I didn't plan it this way, but it really showed me that was one of the engagement where the field office director, Sidney Dexter is his name, and he fought in the Vietnam War. And he said that the Hmong community, without them, he and his comrades would have been dead. And he said, I'm eternally grateful to you, and this country owes you a debt of gratitude. And I will personally make sure that the issues that you have will be addressed. And even before I got to the airport that day, Sidney had sent out a note to this, 40-some people who came from all over, and they were there at like 8:30 in the morning, and told them that he was going to follow up with several meetings with that community. And that to me really speaks so highly of the people that are in these agencies, that I think they really do want to reach out, but sometimes they just need a little help, a little map, and getting some people who are from those communities, like us up here and many of you out there, really does make a difference. So I wanted to give the rest of the time for questions. So if you would like to ask a question, if you don't mind coming up to the mic and just making your questions brief, or if you have a comment, we really would love to hear from you. And I hope that many of you do go to the White House website and look at all the agency plans, because you have to hold us accountable that the implementation part of this, I hope, will be as advertised, and it's in your hands now. Anybody? Good, a brave soul.
I asked before, and I didn't want to ask again, but Lieutenant Tammy Duckworth is here, and so I just wanted to, it's great to hear you and your story, and the National Alliance for Filipino Veterans Equity was really proud to work with you and Secretary Shinseki and General Taguba when he was the advisory chair for the Center for Minority Veterans about Filipino World War II veterans, right, who were first given military recognition and officially recognized at the VA. There have been some bumps along the way, and we're happy to be working with you to address some of those, but I think one of the things that we had talked about when the first draft of the VA's agency plan came out was something that you touched upon. So I wasn't actually going to ask a question, but you brought it up, and so I'm really intrigued by the idea of the legacy of AAPI veterans. You know, the shoulders on which you're standing from the 442nd. I would humbly include the folks from the Philippine, World War II veterans and the Philippine Commonwealth Army. But if you can speak about, what the agency's plans are to maybe hopefully raise the profile of AAPI veterans and their sort of historical legacy, that'd be great.
Sure, absolutely. And a big part of what we're doing to do so is to actually talk about it and promote it on our web pages as part of our overall promotion. I'm drafting a blog piece for this month for this very issue, and I also address the contributions of Filipino American veterans, the Filipino veterans, also the contributions among, I mentioned also, of course, General Taguba, and there's a man of great integrity who did what he was asked to do, told the truth, spoke up, and was not rewarded for it. And yesterday, of course, we have a new Medal of Honor recipient who is a Pacific Islander from the Korean War. So what we're doing is, of course, promoting this through educational campaigns on our new media, social media site. I certainly include mention of Asian American and Pacific Islander veterans in all of my conversations. One of the things I've done this year is I've actually created the Office for Tribal Government Relations. And what this office does is actually, for the first time, actively engages VA as an entire department with leaders of Native American and Pacific Islander and Native Hawaiian veterans, something that has never been done before. We've always treated our Native American, Alaskan Native, and Hawaiian Islander veterans as individual minorities within the Office Minority Veteran, which is fine, and they were getting great service, but nobody was trying to reach out to the leaderships of the community in order to gain access. And in many of these communities, there's a real need for tradition and a real need for recognition of tribal leaders. You can't just, think that you're going to gain access and bring in a vet clinic or bring in something into the community if you don't actually show proper respect to the tribal leaders and the community leaders, so that they know that you are there to help, because it's their job to protect and serve their people as well. So that's one of the big things we're doing is setting up this office. We're also, a big chunk of what we're doing in terms of Native Hawaiian veterans and Pacific Islander veterans, not just Native Hawaiians, but all Pacific Islander veterans, is the issue of homelessness and unemployment, and really trying to promote more jobs, again, the veteran-owned businesses, but also to try to prevent the slide that leads into homelessness. Because once you have a veteran in homelessness, they're so much more expensive to care for, and it's so much harder to get them out of homelessness than it is if you can stop them from becoming homeless. But thank you for bringing that up, and I apologize I didn't mention the Filipino veterans when I spoke about them, because I'm humbled by what they've done and also what they've endured over the last 50 plus years, waiting for the recognition that they deserve.
Thanks, Tammy. I have the question. I think there's another lady behind you. I'm sorry, she's been waiting. So, and then we'll take your question next. Go ahead, please.
Hi, I just wanted to thank you guys and the agencies for doing just really great activity in trying to make everything more transparent. And I'm a millennial. I love the internet. I love social media. So I love that you guys are bringing it to that forefront. But at the same time, with Asian American Pacific Islanders, some of the data on broadband access about our connectivity to the internet and those different mediums are highly inaccurate, because they don't take into account our language proficiencies and things like that. They don't disaggregate that data to highlight some of our communities that are most need. So I guess I have two-part questions about how we take kind of the social media, the internet, and that presence, and kind of translate that back and make it accessible to our communities. And at the same time, I love the idea of the language line and things like that. That's something our community really needs. And how are the agencies all working together to make sure that they're across the board, making sure that they're making things accessible to our community that are language proficient.
I'm glad you mentioned the disaggregation of data issue. That's a huge issue across all agencies. And just one small example within DOT, you heard me talk a little bit earlier about pedestrian safety and pedestrian deaths. There really isn't a valid source or verifiable source of data when it comes to AAPI pedestrian deaths in major metropolitan areas. That is one area where there's a huge data gap. And I think there are many other examples of that across all agencies, but it's an area that needs to be looked at. We need to pay attention to it and make sure that there is good, solid data on that and many, many other issues.
I think one of the things to address about, at least in the infrastructure side in the President's State of the Union, stated that there's a commitment to investing in infrastructure, which included a broadband plan, which would cover 98% of Americans. And so I think as we see, the budget battle and kind of go forward, I think one of the important investments that the President has committed to make in order to win the future has been this piece on broadband. And so I know that the data may not be there, and I know there needs to be obviously a disaggregation of this data, but there is a concerted effort by the administration to improve broadband access, at least on that one point there.
Thank you, Bryan. There was another lady who had a question. You want to go ahead?
Thank you for all the members of the panel for having done such great outreach work. I have a question more related to the veterans, and this is for Secretary Duckworth. In my former work with the veterans, I had recommended pre-deployment and post-deployment medical monitoring because there was always some uncertainty when I evaluated the questionnaire taken from the service members whether their disease was pre-existing or was it really a causal effect at the theater. So there was always this ambivalence. So I don't know whether that has been done, really make sure that those evaluations were objective. One issue. The other issue was regarding to the PTSD issues. Policymakers at Washington agree with all these initiatives, but when it trickles down to the regional level, that's where the problem is. And the typical work was that a veteran would go to, I don't want to mention, okay, I came from Connecticut, let's say Hartford, for example, and then saw a doctor and said, oh, I have something mentally. And the doctor said, is it all in your head? I mean, I'm like simplified it. It's an attitude problem. And if the local provider did not acknowledge the service member had a mental problem and then get kicked up at above level to get more referral, eventually ended up to Waterloo, that person is locked in there. And it's a very serious issue, and I know people have tried to do things, but that's the thing. And with regards to Asian, that's becoming even worse because we're so ashamed to have that mental block. And especially with people from the Navy, they're so heroic, like the SEALs, they don't recognize they have that issue. So if there's some progress in that, maybe you want to make a comment.
Sure, those are both very important questions. As far as the deployment, pre- and post-deployment evaluations are concerned, we're working much closer with DoD because both the pre and the post are done by the Department of Defense. We don't get to look at them until they become veterans or if they come to VA within the first 5 years after deployment. But we are working very closely with DoD to do so. One of the ways that we're looking at the post part of it is that VA recently expanded access to VA facilities for any veteran who's deployed within the last 5 years. They can come and get care at VA. They don't have to wait until they're out of the military, and they don't have to get permission from their commanders, for example. So someone who's still serving in the National Guard or Reserves or even active duty forces, if they don't want to go to an active duty mental health clinic, for example, because they don't want their command chain to know, they can actually walk into a vet center, they can walk into any VA hospital or clinic and get the care. And in fact, this is good for everyone here to know because if you know a recently deployed service member in your lives, if they come to a VA facility within the first 5 years of their deployment, even if they're complaining about a sprained ankle, we screen them for both post-traumatic stress and a brain injury, 100%. So oftentimes, these men and women who are so macho, and I use that for both the men and the women, and who are so tough, who want to take care of everyone else, will be the people who are the most in denial that they may have a brain injury or that they may have post-traumatic stress. So if you as family members and friends and coworkers can say, boy, you've been complaining about that sore elbow ever since you came back from deployment. Why didn't you go get your elbow looked at VA? Because I know that you can go for free. When they come in, we'll screen them for the post-traumatic stress and the brain injury, as well as the sore elbow. So that's something that's really good to know, and that's part of it, because then it takes away the stigma of being screened, because everybody's got to be screened. Everybody's got to get a blood test, everybody's got to be screened, everybody's got to fill out the forms. It's just a regular step. So that's one of the things that we're doing. The other thing, and really that expansion from 3 to 5 years happened under President Obama, who signed that in. The other thing the President has done is approved us to allow for the new ruling in that if any veteran is declared by a VA doctor as having post-traumatic stress and they have been in theater, we presume that that post-traumatic stress is from their service in theater. Prior to this, a service member actually had to come up and show documentation that they witnessed an event, that they were part of an event, they were in an explosion, they saw a friend die. They had to show proof that they saw some sort of a traumatic event and that they were in Iraq or in Afghanistan. The new ruling, which relaxes the standard, is that if any VA physician says you have post-traumatic stress and you were in the Southwest Asia theater, we will presume that it's from your service and you don't have to go any further. So that reduces the burden of proof and that allows them to gain access, and that's really just happened within the last year. So that addresses the issue that you raised specifically. But you're right, we can always do more for our vets, and you know, reaching out to them wherever they are is really the key, and also enlisting every single one of you into knowing about some of these benefits, because you never know when you may be the one person who talks to a friend or a nephew or someone and tells them, hey, did you know that you could just go to VA for that sore elbow? And they go in and then they find out that they may actually have a concussion that they didn't know about.
Yeah, I apologize, but I think we're at this point over our time, and I know a couple of us have to be somewhere real soon. So if there are other questions, I guess you can maybe take it up with Gloria, and she can give you some of the contact information from us. So I just hope that this panel today gives you a sense of what is going on with different federal agencies in the White House Initiative. There are 23 plans on the White House website, so I hope that you read it and you provide input, because this will not succeed without your active participation, feedback, and frankly, holding all of us accountable to what's in those plans. And so I wanted to thank the panelists up here for taking the time out of their schedules to do this, and most of all, for all of you coming together to be with us here today. So please give a hand to everybody.